one and all. And it's a great, and thank you for your kind words, Bistra. And thank you, Children's Heartlink and PCSI, for giving me this opportunity to speak on this platform. So today I'll be talking about developing a global value-based care measurement set for congenital heart disease. And a little bit about ICHOM, which Bistra, of course, will explain to you. And then the development of international standard set of outcomes measurement for congenital heart disease, step towards value-based healthcare worldwide, the process, the method, the nursing perspective, and third, limitations and the need to implement in India. So over to you, Bistra.
Yes, I'll do a very quick introduction. So ICHOM stands for the International Consortium for Health Outcomes Measurement. It's a nonprofit organization with offices actually in the United States and England. And what they do, their goal is to promote value-based healthcare. They do that by defining global standard sets of outcome measures that matter most to patients. So they look at different disease groups, diseases, and develop measure sets of outcomes that are very important to patients and to their families. They also drive adoption, which means try to implement the measure sets and make sure that they're implemented and adopted by different providers around the world. There are about 39 there are about 39 sets. You can go to the next slides that have been developed so far for different conditions and for specific populations. These are some examples that you see on the side. On the right side, there's a number of pediatric related, a number of cardiac related and cardiovascular system related, a number of general practice or general health related measure sets. All the measure sets are actually free and available to anyone, and they have an implementation guide as well. And over 600 organizations have implemented them. With the congenital heart disease measure set, you can go next, Julie. With the congenital heart disease measure set, this was a standard set to support patient-centered comprehensive healthcare delivery and outcomes throughout the lifetime. And what's important, and Julie will talk more in detail about that, that this is a really lifetime or a life course measure set that is that involved a lot of patients and families in the consultation of the development, and includes congenital heart disease for children, all ages, as well as adults. The next, Julie. We had actually several sponsoring organizations who initiated the development of the measure set. Children's Heartlink was one of them, but you can see the other ones here. All of them provided sponsorships as well as expert opinion. Children's Heartlink's role was specifically, we wanted to bring the perspective from low and middle income countries like India. We also wanted to engage patients and families from low and middle income countries and invited several of those. And really the goal for our organization was to standardize the outcomes globally. And go to the next slide, Julie, and you can start actually explaining how this was organized. So I will stop here and Julie will take over.
Thank you, Bistra. And this is the world map which displays the details of 22 working group members from 15 countries and 6 continents from all over the world. And the working group consists of CHD experts from cardiology, cardiothoracic surgery, nursing, patient and family advocacy, researchers, and global health system strengthening. So talking about the prevalence, globally, around 1.35 million babies are born with CHD every year, and about 9 out of every 1,000 live births have CHD globally. And 28% of all congenital defects are defects are congenital heart diseases. So in India, the number of children born with CHD is more than 240,000 per year, and 1/5 with serious defects which require intervention within first year of life. And out of these, only 1/4 seem to receive the optimal care. So there are a lot of challenges regarding CHD care in especially the lower and middle income countries, mainly the financial constraints leading to poverty and malnutrition, health-seeking behavior of the community, lack of awareness, illiteracy, gender bias, cults, and false beliefs, and of course, lack of follow-up care. And there has been lack of resources, especially the health facilities of pediatric cardiac care centers. And there has been found disparity between high and low middle income countries. And due to all these things, delay in diagnosis, delay in referral and treatment adds to the burden of congenital heart disease. So congenital heart disease is the most common congenital malformation, and the CHD population receiving cardiac care is on an increase. And CHD being a lifelong disease, the outcomes need to be measured longitudinally. However, tracking of long-term outcomes is lacking, limiting the delivery and measurement of the high-value care despite health system resource utilization. And it has been found that majority of the outcomes that have been measured have been predominantly found functional. And we need to experience other aspects of the patient experience also need to be considered. So measuring outcomes is the first step towards global value-based care for CHD to provide quality and outcomes which are meaningful to the patients at an affordable cost. So ICHOM standard set was the first international development of stakeholder-informed standard set of outcomes for congenital heart disease. It is of course a model for a lifespan approach of CHD to provide a baseline for decision making and comparative effectiveness. It's also a model of QI initiative and to bring improvement among health systems for CHD population. So this figure demonstrates the ICHOM process and steps used to develop the standard set of outcomes. So there are mainly four key steps. The first one, as I spoke, is to develop a working group representative of all CHD stakeholders, like the patient and the provider and the registry leaders. And the second main was to to have extensive literature reviews to identify scope and outcomes of interest and to identify tools which are used to measure outcomes and case mix adjustment variables. And finally, an outcome set was created using a series of multi-round Delphi processes. And finally, the need now is to disseminate the set worldwide and to share the word. So the working group has created or developed a 15-item outcome set of physical, mental, social, and overall health outcomes, and with tools for measurement and case mix adjustment variables. It including both adult and pediatric of all ages. And all stages of CHD have been included like major, minor, severe, or critical CHD. And finally, after an open review survey with broader patient, family, and provider group, over 80% of the people surveyed agreed with the set in the final form. So this is the final set of 15 outcomes for congenital heart disease for adult and pediatric. The overall health outcomes included our quality of care, health-related quality of care, perceived health status, and for mental health, we included behavioral and emotional development in pediatrics, and anxiety and depression in adults, and cognition as well. So in physical health, we included survival, heart failure, arrhythmias, growth, activity level, pregnancy, and motor development in pediatrics. For social health, is also very important. So we included financial burden, the productivity level, and family quality of life in pediatrics. So, so far the set has not been implemented after being developed, but each set comes with an implementation framework and the steps, and which can be seen on the website. You can find it on the website. So for implementation, the working group recommended this following timeline to collect the data from patients and the clinicians at regular timings, like from the baseline, 6 months, 1 year, 18 months, 2 years, and so on. So this is the paper that was published in European Heart Journal of Quality of Care and Clinical Outcomes in February 2021. It is available in the October issue of 2021 as a print. So talking about the nursing perspective, I received an invitation from Children's Heart Link, thanks to Bistra, to join this working group as a nurse residency expert from a nurse research expert from a low middle income country for a period of 18 months project. So initially I thought over it for some time, and then by my support of faculty, especially Dr. Anita Saxena, and my great interest in quality care and love for the little hearts and my knowledge and experience for this, I accepted this global effort. And my experience of 34 years of extensive my 34 years of extensive experience with the CHD patients and their caregivers from different socioeconomic levels and from all over the country. So the knowledge and experience which I gained and the expert faculty at AIMS New Delhi, due to that I could provide my required inputs for preparing the outcome set. And then I participated in the manuscript writing as well. And it was indeed a wonderful journey of sharing and learning while successfully constructing the first global outcomes measurement set for CHD in the targeted period of 18 months. So there are, of course, limitations of CHD measure set, like cost and time resource intensive and potential data inconsistencies and possible lack of interoperability with health records and alignment with existing QI registries and possible lack of cross-cultural validity of the tools in low and middle income countries. So why this set should be implemented in India? So we find that there has been an increased cardiac care centers. It's almost 90 now. It has jumped from 14 to 90. This is an old figure written here. It's more than 90 now. And pediatric cardiac care is improving in India. So we have increased number of cardiac care specialists as well, more of physicians, expert physicians, surgeons, nurses, and intensivists. And certain government programs and schemes have also come up. So CHD population receiving cardiac care is definitely on an increase. So the need of the hour is awareness and sensitization of all the clinicians, the caregivers, and the patient CHD population as well. So value-based care needs to be a priority. So in conclusion, I must say that outcomes can be, success can be measured only by measuring the outcomes. So a condition such as CHD will benefit from a standard set of core outcomes that are meaningful to the patients, families, and care systems to provide a better high value care and lead to CHD success worldwide. So now the need is global communication, implementation, measuring and sharing of outcomes, comparing, and bringing about improvement to provide high value care and a positive impact on overall health of CHD population worldwide. So it is indeed a transition towards CHD success worldwide. These are the references, and thank you for listening. Any questions?